I'm very happy to be talking today. Yesterday, as I was speaking, there was like tweeting going on about how I was pronouncing some words, so I'll be very interesting to see if that's going to happen today. So I promise to not say bureaucrat, because supposedly I put too much R's in this, according to some people tweets. So some systems of oppressions at play. So anyway, I just want to acknowledge some of my colleagues that are working on the Sex Now, because there's a team of us, and this is the 2010 survey, and obviously I'm not the PI on the Sex Now survey. Terry Trussler is, and Rick Marchand, and Justin Gaud last year that did such an amazing job at doing the recruitment and get us to have a sample of 8,000 guys, which I wouldn't be able to present the kind of an analysis that I'm going to present today, which is very preliminary. Another word. I'm on Twitter now. So it's a very early analysis that actually just occurred last weekend. So it is just me trying to explore some new concept of way of defining our population, basically. And I've done a lot of talk in the Faculty of Health Science about the epidemic of the gay epidemic of HIV, and I often insert this quote, and I thought it was very appropriate for today as well. And it's a quote from David Alperin, and he wrote a book called What Do Gay Men Want? And this is actually the first lines of the book, and he said, according to a number of recent novels, gay men just want to be held. According to some current writing about HIV/AIDS prevention, gay men actually want to be killed. And that really reflects how I feel about a lot of epidemiological writing, but also about the discussion that's occurring in public health. Why are gay men not using condoms? And we never really discussed the kind of social context and what do gay men want, which is intimacy within this context. So that's kind of a bit what's driven me to kind of look a bit deeper in my presentation in a social context where unprotected sex is occurring. Well, we've had a decade of sex now, and we've looked at our youth data, and Rick and Terry has done a lot of analysis on that, and we know that there's differences between youth and older gay men, non-youth gay men. And what we've seen is that youth are usually less knowledgeable around sexual health, less likely to adopt health-seeking behaviors such as testing. And what we've noticed a trend through sex now is risk behaviors have increased among youth over the years, and that the internet has become very predominant in the life of gay youth. So again, I think you've heard that before. So in 2010 was the first time we launched Sex Now as a national survey, and our theme that year was mental health. And obviously we were not like, that was not a genius idea to explore mental health. A lot of people have actually looked at mental health and the relationship between mental health outcome and HIV and unprotected sex, specifically depression. And I think what we did that others didn't not is that we had a lot of also data around and question around marginalization and the social context that taint the life of those gay guys. And this is a model we're introduced to Elaine Mayer's model, and as Keith said in my intro, I'm teaching right now a course, and I'm reviewing all those models with my students. And this is the Syndemic production model that was kind of built by Ron Stahl and his colleagues. And I know a lot of you have had exposure to that model because he's done presentation nationally and at the Ontario Gay Men's Health Summit that a lot of you have attended. And actually, the model itself is very complex and doesn't fit in one slide, so this is kind of like the simplified version. My student had to go through the 3 slides model, but I'll bear you to just the one. But what's very important to remember in this model, if you're not familiar, is that it is really embedded within the social context, and that gay identity is developing in a context where there's very strict gender roles and is very tainted by high degree of heterosexism and homophobia. And while their young gay men are developing their identity, they tend to initiate first contact with the gay community within this context, and that may lead them to access to some degree, both weaknesses and strength to the gay community. Some of the weaknesses could be a continuous sexual shaming or sexual violence, and a community that has high rate of abuse and STI, but also a lot of strength, such the first time they actually kind of meet some friends, social bonding, sense of community, healthy sense of being gay, and also kind of the chance to get laid finally, which is not in his model. That's my added piece. But so, if we take into that account that also that, if we're unable to balance both the strength and the weaknesses of the community, that may lead to the development of psychosocial problems. And what's very key to Runstall model is that those psychosocial problems interact with one another and may actually have some kind of snowballing effects that may lead to the emergence of health problems such as HIV and AIDS or STIs, but also other problems. So I was kind of preparing my lecture and kind of trying to kind of explain this model, and I thought, could we see kind of a syndemic within our population of youth in the Sex Now survey, and that's what I'm going to explore with you today. So this is Sex Now survey. We had about 8,000 people, so I'm only going to use for my exploration today the kind of the youth sample, which was 747 guys, which was about 10% of our sample. It was great because usually when we had a sample in the past, we could only kind of get good analysis on the 30 under. So, but now we know that someone who's 29 probably have a different experience than someone that's 19. So that was great that we could get kind of really the younger population and their experience. So I think this was covered yesterday. So first of all, I tried to look at some, in which context those young gay guys are becoming young adult and young gay adult. And I look at different marginalization indicators that we can take in our survey. Anti-gay violence, physical gay violence. And I took suicide ideation and attempt as being kind of maybe not a marginalization itself, but as symptoms of marginalization. Child sexual abuse, forced sex, and career affected. The verbal anti-gay violence, suicidal ideation, and intent were actually much more higher among gay youth. And if you have this slide there, if we look through different generations, you see that there's been that actually those are. I need to specify that those are lifetime experience. And what I find very troubling when looking at this slide is that in the context of when Ilan Mayer yesterday said that, things are actually getting better for you, what we're seeing is that for all the outcome of marginalization, youth are not doing better than the previous generation. And actually, you can think that already at 25 and under, they've actually faced the same level of marginalization or more than most adults in their lifetime experience. So they had a shorter time of exposure because they had a shorter life. So this is a bit troubling to me to look at this. So what I did after is I was trying to do this exercise. Can we quantify the marginalization? And what I did is I kind of added up how many marginalization youth had. And about a quarter of youth had no marginalization. They had none of the indicators that I showed you before. And after you had a division where 28% reported 1, 21 reported 2, and about 25% actually said that they had 3 marginalization. So they were probably in some sort of way more marginalized, or through many more pathways at least. And after what I was trying to look at is this levels of marginalization in line with some psychosocial issues that we could find in our survey. And I look at which psychosocial issues we had, and I look at emotional distress. So if you look at emotional distress, only 32% of those that had no psychosocial problems had some sort of distress, while if you had the group that had 3 or more pathways of marginalization, they had 63% emotional distress. Similarly, for social isolation, we see 22% in the group that had no marginalization, up to 43% among the most marginalized, or more. Substance abuse from 11 to 33%. And treatment for depression, this one is quite dramatic, from the people that had no marginalization or that didn't report it any in their survey had 5.8%, and it went up to almost 50% among the people that had three markers of marginalization. And similarly, among other treatment for mental health, there was an increase from 18% among the no-marginalization markers to 58.4%. And also, I try to see, to see if there was kind of a snowballing effect of marginalization of psychosocial issues. And this is, if you look at the youth, about 25% say they had none of the psychosocial issues that I've stated before, and 25 had one, and another 25 had two, and about 25% had three or more psychosocial issues. And actually, this is in line with Ronstahl theory, because you say between 1 in 4 and 1 in 5 gay adult will be impacted by some sort of syndemics in their life. So this is a complicated slide, and I bolded kind of two columns to make it easier for you to kind of look the link between marginalization and developing multiple psychosocial issues. So if you had no marginalization, according to the indicator I reported, you see that the half didn't had any psychosocial issues. It goes on to 29, 14% if you had two issues. But if you had two issues, and if you had three or no marginalization, your chance of having three or more psychosocial issues went up to 6.3%. And if you want to look at the other extreme, people that had multiple marginalization indicators, well, we kind of see the reverse trends. Your chance to have no psychosocial issues was 8.5%, and it goes up to 46.8% for the three psychosocial issues or more. So after this is, I wanted to see, well, okay, the theory of Syndemic of Ronstahl is about looking about the chance of about HIV infection, and obviously HIV infection happened within our community through unprotected anal intercourse with an unknown or different status partner. So first of all, this is the data before I contextualize within the Syndemic model, and we can look for both top or bottoming, and we see that young gay men were actually much more likely to bottom than older gay men, but about 35.2% of youth, 25 and under 25, reported one episode of unprotected anal intercourse within the last 12 months. And I also look at STI, and about 8.8% of our youth in our sample reported an STI in the last 12 months. So again, now I try to look at it. How does that match psychosocial issues in UAI? So the people that had no psychosocial issues, the number of UAI went down to about 25%. And if you had one psychosocial issue, it was 27%. Two psychosocial issues, it went to 32%. And the dramatic increase is among the group that had three or more psychosocial issues. There was 43.6% UAI in the last 12 months. And I felt there was so many statistics, so I didn't include it like p-values or OR, but it was statistically significant. And the group that had three or more psychosocial issues, the OR was 2.5. And among STI, we are seeing the same increase from the people that had no psychosocial issues. Had 7.2% an STI in the last 12 months, when it went up to 14%, so quite double in that group. What I forgot to mention, which is interesting, is if we were to look independently to all the psychosocial issues, they're all related but have very little effect on UAI. So it was really the impact of combining them together that really show a difference among the population. So this is very exploratory, and I would be very open to hear your comments and questions about this. But to summarize some of the idea of everything I've presented, and I hope I didn't lose you in in all the percentage and 1 and 2 and 3 and 4. But basically what I can say is that marginalization has heated up in youth, and youth today are more affected than previous generation. Marginalization is associated with gay men's experience with the community and the development of psychosocial difficulties according to a survey, and that we're seeing that multiple psychosocial difficulties is associated with an increased proportion of UAIs with an unknown partner and STIs as well. So this is my plea to you. Actually, this year in our Sex Now survey, we actually have much better indicator of marginalization. We have a much more better indicator of psychosocial problems. So it's very interesting to do the analysis now because we will have a set of data coming up soon which will actually provide much more depth and be much more accurate of what I tried to explore today. And so if you are gay or if you're a man who have sex with men, if you're homosexuals, please do your survey. This year our theme is the census, the unofficial gay men census. Count yourself out, tell your friend, tweet about it, and thank you.